Here I am again, Sue Nelson, and now I'm going to show you how to do sterile technique doing a sterile straight catheterization. We have a male and we have a female, but we're going to kind of do the female, but we're going to talk about the male and kind of give you a little bit as we go along. As before, you always do the always list. The always list is an important thing. You must have an order before you perform any type of procedure because of the possibility of assault, battery, and charges of negligence. You wash your hands. You identify your patient. 2 identifiers: patient's name, patient's birth date. And then I also always ask them about allergies. I provide privacy. Again, close the door. Pull the drape. You never know who's going to walk in that room. They do knock, but sometimes they knock and they just enter. Explain the procedure to the patient. Just basic. What are you going to be doing? Raise and lower the bed properly, and also raise and lower the side rails. As you can see, I already have the side rail up on the left side of this patient, which I would at that point put up. If not, I'm going to put the bed up into a position. Now I'm going to go from the end instead of the side today, but I have most of the patient under my control.
Side rail is up.
I have my supplies. First thing I do, of course, is wash my hands, and I come in and I identify my patient. Hi, my name is Sue Nelson. What is your name? What is your date of birth? And do you have any allergies? Now, this is not, we're going to be putting a catheter in. This is just to empty your bladder because also I need to check a urine specimen. So we're just going to do a straight cath, empty your bladder and get a specimen because the physician wants a sterile specimen before you go to surgery tomorrow. Have you ever had a catheter before? No? Well, this will be your first. I'll explain things. It should not be painful. It's a little uncomfortable when you do any type of procedure like this, but it should not be painful. Please let me know if it is painful at any time. So the first thing I'm going to do is, as I said, I've washed my hands. I'm going to wipe off my table. Again, I have no idea what has been on this table. Bedpan, a urinal, person's lunch, someone came in, a lot of people touch it, so we don't know. Since it's going to be my sterile area, I want to make sure it's clean. I then have my catheter kit. I have a straight catheter if it does not come in the kit, and then I have some lubricant. Lubricant does come in the system, but because I am currently using a mannequin, I'm going to be using a soap, Castile soap, just because it makes it easier to clean the mannequin and it doesn't get all goobered up inside him. Goobered. Now this is where we need to make sure that our patient
I'm gonna come in a little closer.
Is in a good position. The legs go up into what we call a frog position on a female. And you basically put leg to leg, heel to heel. So you've got an open area here. You try to cover them up. If you have something to put over them, you can cover them this way, such as a towel. Could you please hand me that towel? Or another pad. So I'm going to just give them a little something over the top as a protection. Gives them a little comfort, doesn't allow them to be too cold. So first thing I would do is I would clean the patient. Wash them, soap and water, or some kind of a cleanser that you would use as a towelette, but you would clean the peri area, not just the peri area you're going in, but also up the legs. So you would clean that before you do anything prior to doing a catheterization. I'm then going to open my kit, and this kit I usually also will take this and put these down at the feet area. That's going to be where my garbage goes. You open sterile kits away from you, away, away, and then away from you. And then the last one you catch and you bring it forward. Now, anything inside here is considered sterile. Now, there is one piece right here that you have to open up, and some of the hospitals have it sterile, some don't. It has a plastic, if you can see the reflection of the plastic on the one side, and the other side is more of a paper. This is a water prevention, and what I do is I lay this down there, reach underneath their leg, and put it in an area so it kind of gives me a little sterile area down there. Not all hospitals use it that way. Some hospitals just have it there to collect any drips. There is then a catheter, which you can have someone open the catheter for you, or you can open this catheter and leave it along the side here as sterile. Now I have to put a pair of sterile gloves on. The sterile gloves are inside the package. It's a size large. Now where in the world am I going to open these? Now because this is, I'm going to leave that alone because it's too high of a chance of me contaminating it. You can do it here. You can do it on another table, but you never should turn your back on your sterile field. Just like in your sterile wound, you never lower your hands below your waist, you never turn your back on it, you never reach over your field. Those are all cross-contaminations. So I'm just going to put my gloves on right here. Now if your patient is a very active person, you may not want to do that. Good thing we learned how to put gloves on first, didn't we? Underneath the lip again, put the hand inside, put the fingers in place. There, the gloves are on. Now because I don't want to lose my catheter, I'm going to take this catheter right out of there and I'm going to put it, roll it up and put it inside my sterile field. Protection. Now I'm not going to need this water because I don't know why it's in there. This is for my specimen, so I can, here's my specimen. That's the lubrication that you would use, but we would not need to use that since I'm going to. But in a normal case, you would split it, put your catheter in there, and leave it in there inside here, and that would be okay also. And then you have a top. This here is a coverlet. Not everybody uses it. You can place it over your patient's area to give you more added safety, more added sterility. It's there. I have also seen them put it here where you can put your hand on it. We're going to put mine here. In the package I have three cleaners. I take my 3 cleaners out and I basically lay them in the boat that I have, the basin. And I'm going to take this basin, which now I can touch the whole thing because it was totally sterile, and I'm going to put this in the patient's bed, about 3-4 inches from the perineum. I then will take my hand and I will open up the meatus of the woman, and I will go down one side, not the center. I will go down the other side, being careful not to go across my field, come back around, and then down the center. The center is the last place you go down because it's a hole, it's an in place, you can put something in. It's slightly different than the actual urinary or the actual wound. Then I lubricate this, and you do not let go. Once your left hand is here holding this open, you do not touch it. You do not move it. It is dirty, contaminated. If the labia lips fall together, then you have to redo the cleaning. You would then pass the catheter into the urinary meatus, and you would place it in there until urine would start flowing from the catheter. And then you would insert it another 1 or 2 inches. That is so that when you use a catheter, you want to get it into the actual bladder. So you want to use that. If you have a catheter that's going to stay indwelling, it actually has a bulb on it, which is about 1 to 2 inches further up on the catheter from where the hole is that the urine comes through into the catheter. You want to make sure that when you inflate that bulb, you're not inflating it in the urethra. So you want to make sure it is in the bladder. So this is where you can now take this, get a specimen, or you can leave that specimen till done. Once the urine starts slowing down, you pull it back slightly, let it flow some more, pull it back a little bit more, let it flow some more. When it's finished, you just pinch it and take the catheter out. And then you place this in your catheter up on there. You then would do peri-care on your patient, and then you would be done with your catheterization. Then you would get your urine. This has a measuring, but you can tell that. Get your urine specimen to go with that. Now, a little bit about how would you clean the male? If you had a male, and this is a male adaptation, you would actually take hold of the glands, the shaft, and then you would clean in the center here, and you would go around the entire glands, throw it away, do it 3 times. And the 3rd time, I usually dwell a lot at the opening. Now, what if your client had a foreskin? You would need to, when you wash that, retract the foreskin past the glands so that you could actually get to the meatus and the actual urethral opening. Sometimes the foreskin does not retract. You would then try to pull it back as far as you can on the glands and then cath that part into the urethra. Once you have cathed the male, or once you've got that clean, you would then take your catheter, put it in. It takes about 6 or 7 inches because you have the length of the shaft to go through before you actually, plus you might have, what if you hit something and it wasn't going in? That probably is the prostate on a male. When the prostate is hit, it will not go by. You do have a special catheter called a Coude catheter. I'm sorry about that, Coude. It has a little bit of a bend on it, and it's a little stiffer. It will usually pass that prostate once it goes up. Same theory, once you remove it the same way. Once you're done, you clean it and you pull the foreskin back down into place. So, what have we done? We have done a sterile catheterization for both male and female. This concludes how to do a sterile catheter. Remember now to put the safety, put your side rails back down, put your bed back down. Safety was keeping sterile. You identified your patient. You've done very well. I thank you for watching this video.